One of the big things that we don't think about with Lyme is the way that it can connect to skin issues. So, this story that we're going to walk through today has a good bit to do with skin as kind of a presenting factor, but also some just early in life feeding restrictions, weight gain issues, things like that. So, we're going to be talking about a little gal that I started working with when she was about 15 pounds. And she is now quite a bit bigger for her, but she's still quite a little gal. So Megan, her mom, is not necessarily new to the functional world. She had worked with other practitioners and kind of been on this road for herself, and then was referred to our practice for her very tiny person. So Megan, I just kind of want you to share with me a little bit about how old Sienna was when we started, where she was, the challenges you guys were kind of facing in winter of 2022 when you looped into care.
Yep. So Sienna was about 9, 10 months when we started working with Elizabeth, and we came to her as we were struggling with weight gain. As Sienna was actually born quite small, she was diagnosed with in utero growth restriction. So we did know she was small, but we did not know she would stay on this track and have the journey to get her to grow. But she developed some pretty major skin issues in her diaper area around 6 months that we started to work with our pediatrician with pretty seriously on trying to just diagnose why wouldn't it go away, using multiple different topical treatments. And for months on end, which felt like that, but for 3 to 4 months, when you have a continuous considered diaper rash, we never got to a point where we felt we were getting any relief. Seeing multiple pediatricians, a couple dermatologists that we went through, and then just overall being an advocate as parents, asking more questions, what else and how else can we get this diaper rash area clear? So that's when we started to look into the more holistic route. And I have worked with a couple functional nutritionists for myself uh, throughout my journey. And I actually was referred to Elizabeth for pediatric or for young kids. And that's where I found Elizabeth for Sienna. And we started about 10 months on a eczema route is
Mhm.
where we would kind of, I would consider how you approached it from the beginning based on what she had going on.
Yeah, so when we started, we were dealing with the eczema. She had some bottom diaper rash going on. You were still exclusively breastfeeding, and she was around, I think, 8 months when we did our clarity call, so probably about 9, 10 when we started. And she just really
Yeah.
wasn't eating much at all. And I think we started working together before you introduced solids at all. We did a GI
Big
map,
time, yeah.
yeah, and an MRT to kind of see like food sensitivities, like what's there? Is that part of the food issues before we started bringing things in? And you tailored your diet on behalf of her because you were still breastfeeding. Um, but I know that as we worked through things, we started to see kind of ebbs and flows around sickness, maybe around vacation, things would get a little better. So also just like from your perspective, I remember in the beginning, like, what was it like to navigate through having a baby who was having feeding challenges? You were exclusively breastfeeding. We could see things were causing reactions. Like, how was that just day to day for you guys?
Yeah, we just were question marks would come up every day. I would say that it was never we never really understood Sienna quite well because it was like, okay, is it diet? Is it something, with my milk? Is it something
Mhm.
that just she's just not going to eat a lot and not grow very fast? Quite she literally would not. She still to this day doesn't grow very fast, but
Mhm.
I mean, we would go to the doctor for weekly and bi-weekly, and then we got to a point and monthly weight checks. So it was daunting as a parent. The postpartum depression I was knee
Mhm.
deep in because all you want your kid to do is grow, and that was something that we found to be our biggest challenge. Yet again, we were doing what we thought all the right things.
Hmm.
So it just was it was a very long winter. We live in Wisconsin, and it felt like it was something that we were in a dark hole because of how Sienna was growing, eating, and just going around other kids that were her same age. She was a half the size, if not a quarter. And
Hmm.
it's hard to do that too. And just being able to know that there wasn't anything we were doing wrong. We just were working through trying to get answers.
Yeah. So in that beginning season, we used a stool testing. There were definitely some answers. There were very low beneficial bacteria. She had some elevation of what I would call like despotic or unfriendly bacteria, and her immune markers were really, 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 really active in the gut. So we took that information and kind of compared it to her food sensitivities, and they kind of mapped out a little bit, kind of like suggesting some fungal issues, but they weren't profoundly high. And a lot of times when immune systems are really high, you're going to expect a lot of food sensitivities. That wasn't necessarily the case for her on paper. And then I do think, we worked through things for a while and we saw intermittent improvements and things got better-ish. And then late that spring, she had COVID, and that's when things kind of blew up even more. Do you remember maybe what was going on around that time and like what that
Yeah, we had
like?
traveled, so we went to Florida for spring break. Her daycare closed, so she did go to full-time daycare, so it was something we chose to do to take her. And we all traveled. She came back. She was actually sick for quite a bit of the trip, and came home and got COVID, and then also us as her parents got COVID, so we knew we must have gotten from her.
Mhm.
But yes, we did notice that when she was sick, she would eat even less. And she also, the flare up of her skin was far worse.
Mhm.
At that time, also, it not only had spread from her diaper area, the skin, it was very much so on her cheeks,
Mhm.
that we
Mhm.
noticed, into that almost close to the 1 year mark. It
Mhm.
came on to more of her, uh, face, but not fulfilling her face, just her two cheeks.
Yeah, and we were still kind of in the hole when it came to feeding, right? Like she was into purees at that point, but still not
But
much.
barely. Yeah, it was more, she officially, when I would say starting eating solids was around 16 months. So from like 12 to 16 months, which is seems like you would have a really good grasp on solids by then, was more of a it was the 6 to 12 months in time frame in a typical kid. So up to 12 months, she had really no interest in food, whether it was bottles or purees. And then 12 to, yeah, 16, it just really was, um, learning to eat. We actually went through speech language pathology, to work with a food therapist, to help get her to learn to eat as well,
Mhm.
which was a long journey. Thankfully, we are past that and have graduated out of there too.
Hmm. So I know too, like we worked through that first phase, things got a good bit better. The diaper, like top of her bottom, like almost like the back where the diaper would hit, there would be ebbing and flowing of that, and the traditional diaper rash. And then I know we reconvened like in the beginning of 2024. I'm not sure that I really recall what brought that about. I know where she was when you guys came back and we started moving towards questioning Lyme. But what do you remember from that time or the in between? I know you guys have tried appetite stimulants and we're really working hard,
Yep.
like through lots of different means. What was that traditional journey kind of like in that time?
Yeah, so once we got a good grasp on her, like actually having any interest in food, one of the big things was her skin still being absolutely completely exhausting. It was a day in and day out. Every diaper change was lather as much topical steroid or put on, Vaseline or Aquaphor, whatever we could do to get Sienna to stop itching her bottom area, as well as just being comfortable.
Hmm.
No matter what, we had to dress her a certain way because of the way her skin was and how she reacted.
Hmm.
And I feel that that was actually the tipping point is I was exhausted in how the diaper changing and how when are we going to see relief in how we don't not having to change our kids' diaper in a way that we have to. It felt like a dressing change every time versus just cleaning up a dirty diaper.
Hmm.
And because of her skin was so red and irritated. And that's where we reached back out and I said, how can we get off these topical steroids that seem to only make this baby's bottom better for a
Hmm.
matter of moments, and then it's right back to what I would consider her on fire.
Hmm. Yeah.
Yeah.
And at that point too, I think feeding wise, like she was not really getting past purees.
Nope.
When we kind of chit-chatted, you were in Wisconsin, but that rang a different bell in my head this time. And we kind of talked through the possibility of maybe Lyme and Coast because her immune system was just so like hypervigilant kind of in the rashy department, like the reactive kind of a way. Not, sometimes
Yes.
we think about immune systems being hypervigilant, like, oh, I'm never sick. Well, that's actually not great. And oh, I'm sick all the time, also not great. That wasn't
Yeah.
entirely her issue, but it did seem like she wasn't really interested in eating. And sometimes when appetite lacks, it can be because of pathogen load. There's lots of different reasons. But I remember
Mhm.
asking you about like, what are the odds that there's been exposure to these things? Are you open to that? And you popped right back, sharing, kind of an experience that you all had, like epiphany for you. Like when we put the puzzle
Yeah,
pieces
the
together.
exact day of when
Yeah.
yep, something could have happened.
Yeah.
Mhm.
Tell me more about that part.
Yeah, so going all the way back to the journey of when we remember Sienna's skin first flared, which was right around 6 months. And we have a couple cabins in northern Wisconsin that we visit, and we actually had went up to the cabin about 10 days prior to the us noticing Sienna's first what I would consider rash.
Mm.
And it was very noticeable that where the rash was and where it would stem from. And why I go back to this is where we would put the topical steroid, you would put it on and you would clear it, and then we would know right again where it would like light back up from one
Mhm.
exact spot. So that's kind of what triggered the point of was she bit at one point in her lower area or
Yeah.
bottom area.
And of course, we never know, but sometimes we do have pretty solid hints like that. And then something else that happened in the meantime was you guys had tested and gotten low iron levels. And so she had started
Yep.
iron since I'd seen her last. And then you guys rechecked a couple of months later, and there was only a slight increase at that point, which was another cue for me to like, hey, the iron ferritin situation can be dysregulated in lots of different ways with Lyme. So this is worth looking into. And then we did do testing for her and we did fine. There it was. Borrelia was there, which is that Lyme spirochete, Babesia, which is the parasite that's associated. Basically, she had the three most common co-infections, Borrelia, Babesia, and Bartonella. All three of those things were there. So, you know, those things can be connected to the appetite issue in lots of different mechanistic ways. You can not be hungry because there's too much pathogen load. You can not be hungry because there's a lot of histamine from reactions. There's lots of pieces. But once we started it on the immune therapy process, I think even before that, when we really focused on drainage and detox and getting ready
Detox.
for that,
Yeah.
yeah. How did things change for her when we started there?
We noticed right away there was relief in the skin, and actually we hard stopped our topical steroid to work through getting through that phase of like the withdrawal,
Mm-hmm.
which we did not know it was going to happen, but we found out that st stopping and starting, but getting her little body reset, which when I say little body, she was 19 pounds at 20 months old.
Mm-hmm.
And it was something we needed to really make sure we were getting starting immune therapy, getting ourselves to a point, getting that detox. And the skin was relieved in a matter of a couple of weeks where we not fully, but we
Hmm.
saw relief in diaper changes were getting easier, not
Hmm.
having to use as much cream or watching Sienna literally itch herself and not be comfortable day in and day out.
Yeah, hers is really interesting. A lot of kids who have really severe eczema or severe rashes will find that Lyme is a root player because of the way it dysregulates the immune system. Hers is so interesting because it really, really was so locally isolated to like in her diaper area. And
Yeah.
then she had the cheek eczema, which I think that fell off quite a bit quicker. That,
Yeah,
yeah,
a
really
few
started to
months.
ebb and flow as soon as we started prepping for the immune therapy. And the feeding issues were continuing at that point. You know, she
Yeah.
was still having, I think with her too, like even water was a struggle sometimes, like milk was a struggle. Everything, it wasn't
Every
just like,
liquids, yeah, it's
yeah,
yep,
which is
liquids.
so stressful to live in that, like she's tiny, and I'm sure when you're going to the doctor, you're getting the like all the pressures that we all get, even if our kid's
Yeah.
like a teeny tiny bit behind weight wise, and she was definitely very behind weight wise. So,
Just survivor mode. That's how it
mhm,
felt.
yeah.
It's to keep your kid alive without what I we asked many a times. Is she a candidate for feeding tube? I mean, honestly, when you don't
Yeah.
see a kid grow and for how many struggles when it comes to skin, not growing, not eating, all
Mhm.
the above, you just want answers.
Yeah, and there were so many times too where one is so stressful and like I guess I'm curious. I know how I showed up in those times for you, but what was it like to kind of work here versus working in the other realms with like feeding therapy and pediatricians and things like that? Did you feel like a different support or did you feel like, I mean, because I know a lot of times I was like, hey, I'm not going to talk about feeding tubes with you today. We're going to work on what I need you to do, and then we're going to
What we
see how we
can
are in two
do.
weeks. You know, like how
Mhm.
did that feel to go through that while also living in like stress and fear and all those things?
Yeah, making sure that we were heard and being just Sienna's best advocate, it was something that we felt, and to this day, you have to be your kid's best advocate, and asking the right questions and asking more questions of who else can help us. Like,
Mhm.
I still don't think that we would have seen a dermatologist. We would have seen
Mhm.
an additional feeding therapist if we wouldn't have asked for it, or even to see GI to get on a appetite stimulant,
Mhm.
all because we did not feel like at some points in time with different questions we had to ask or were asking, it was as long as she's growing on her curve, she's doing the best that she's doing what she should be doing.
Mhm.
And that didn't quite sit as well with me as it probably could or should. Some parents may
Mhm.
accept that. I was one that just kept pushing because it was we are talking a gal that barely sits on the for 1 percentile charts, and
Mhm.
where do you go if you're not on the charts? You go off it. And the words failure to thrive and the words of just feeding tube, it was something that I was very, very well aware I was okay with if it
Mhm.
got there, but what can we do to not get there?
Yeah, you definitely
And
carried an intuition that like something else is here.
isn't right.
Yeah, it was a regular thing that you were like, eh. And we would check in often, I think, too. Sometimes when people approach this care realm, they're really fearful of like, one, moving away from their traditional providers. That's not something that I really encourage you to do. I often will ask if you feel like you're in a good place with your providers, if your pediatrician's listening, if they're open to it,
Yeah.
you're requesting, or if they're trying to kind of convene together. But also, like, we're always like, I'm not your only person. And I think I kind of made that pretty clear that, like, hey, you need to rock out that feeding therapy. Like, let's take a trip to GI. Let's just rule things out.
Yeah.
um, I'm curious if that supporter help made a difference, or if you felt like there was kind of like a team We
It
never
allowed
worked
me to
together,
have
obviously.
have my I felt in the way I had my pack, like
Mm,
no matter what, if I would go to if I needed to come to you with questions, even questions that my pediatrician asked me, I would come to you
mm,
with, or random questions. But there were times that, yeah, our pediatrician was doing the best they could. They know Sienna only so much, but it was a way that we felt a few times we needed to ask for additional support. We also switched her pediatricians
mm,
twice,
mm-hmm,
given the just the way and the support we were getting. We do feel supported now with our
mm-hmm,
primary care. But it's just it knowing knowing we're heard, knowing we're getting the support we have. We definitely Sienna's had a big team.
yeah.
She's only barely 2.5 2.5 years old, and she's had a lot of eyes on her for
Yeah,
months.
and I think that's so key too. Like you're a first time mom, and I think that there need to be more voices just in the world that say like if you don't feel good in the care provider situation, like you can switch. And I feel like even in the second switch, you were a little bit like, we're gonna go see somebody else. And I feel like a little bit much like moving to some like, could it be possible that they both weren't great? And I was just like, yeah, we can go to somebody
Yeah,
till you find somebody that jives. But also like their job is to symptom support and diagnose, right? My job is a little bit more to be a detective and figure things out, and also simultaneously check in and make sure that the things that are needing to be present, like I was always checking in about language, like is she developing? Are we still
yeah,
walking? Are we moving in that direction? Are all those things continuing? Then it kind of helped too to clear the air that this wasn't entirely a developmental thing, that it seemed to be an immune mediated thing because of the way symptoms would show up. But she was still developing with her low weight gaining power. Like she was still doing,
yeah.
for the most part, what she needed to do. So, what was it like once we switched into once we started immune therapy process? Where did rashes go? Where did growth go? Like, what changed once we started addressing Lyme and those co-infections?
Yeah, so I'd say it definitely was something that a light went on in her body. We definitely noticed it night and day. Within the detox was still happening. You could tell things were dwindling in the skin, but overall Sienna just looked healthier. She gained almost, which doesn't sound like a lot, but she gained 2 pounds in 2 months,
Hmm.
where she gained 2 pounds in 6 months in the first half year of
Yeah.
or being once she turned one, barely 2 pounds. So, and this was the second half of her first year, 18 months to 24 months, that she really took off, and was able to start eating not a whole lot more in intake. When it comes to food, she's still only, very little body, little intake, but she was able to understand that this is what you do, this is how I eat. But really the detox and then into the immune therapy, it was, I would say, a full 8 to 10 to maybe 12 weeks before we saw clear skin, and we haven't stopped since.
Oh, I love that. And is
Yep.
mostly finished at this point now. She finished the bulk of things last week and then has just a few more weeks of one
Yep.
support. Something too, like a lot of times people are intimidated by walking into this process, with a very small child. Like, sometimes you do get a Lyme diagnosis from traditional medicine. There was a bite and there was a change, and families will come to us and say, like, well, this baby is so small and this is what they're recommending we do. And I remember talking with you too, because geographically, like the odds are you probably know someone near you or around you that's had Lyme. You're familiar with the traditional treatment. But like what the beginning phase, did you guys feel confident, unsure? Was it really difficult? Like what was the practicality of, working this through a tiny body like?
I would definitely say, I mean, there was hesitation of reaching out to you, but I was also desperate.
Yeah.
So there's times when you exhaust all efforts and you need help in ways that you are
Mm.
it's unknown chart. It's
New
that
territory.
territory that
Yeah.
with you not knowing that type of care. And I I owe it all to you. That's how I have to say it because there's
Mm.
no other way. Our skin, her Sienna's skin would probably to this day still be the same. We
Mm.
would still be struggling if we did not start that immune therapy.
Yeah, and that really like for her was, I mean, she's small, so little kids can't always articulate other things going on in their body, but like that, the appetite, the failure to thrive, weight gain issues, which could have
Yeah.
had other roots as well. Like I don't think that that was only Lyme, but there wasn't a big symptom load. And
No.
that immune marker being so, so high on her stool testing were really kind of like our biggest clues. But I know in the beginning too, she kind of had some GI stuff we had to work through. There was a lot of diarrhea at first, which is just really the body clearing a lot. And the itching of the diaper rash came and went, but we'd already been through quite a bit of worse, I think, than that. Um, yeah, and then like bathing, and I just think about all the normal things that were difficult for you all to do with her that I would imagine have changed now. Like you should be able to give your baby a bath and it'd be like no big deal. You should be
She
able
has nightly bubble baths that I,
to.
up until about April of this year, 2024, she was unable to be in a bath for more than a couple of minutes because
Yeah.
she would start to itch
Hmm.
and grab at her bottom. So we have a completely different kid. This kid can wear whatever she wants because she's
Hmm.
not grabbing in her diaper region. She can eat what we would hope she, eats, we
Yeah.
put in front of her. We continue to encourage her to eat a well-rounded diet instead of just getting food into her.
Hmm.
It's much more relieving on that end. But it is, we do have a new kid.
Yeah.
It's something that we can be proud of.
I think that's one thing too that folks get really nervous about, and I have conversations Monday through Friday about is food change. And we did restrict her food a teensy bit. Like we removed some fungal feeding groups. With her, I really was like, if she just eat, that'll be fine. But we did remove reactive foods and we kind of stayed away and more of like a low mold, low fungal diet. But once we got into the immune therapy, she really cleared so quickly. Like looking back at my notes, it really was like about a month in, where she was moving right back into dairy and getting cheese in, which for somebody who's got weight gain issues, getting some caloric density there through dairy
Yeah,
is
we
really
work on
helpful.
fats.
Yeah, yeah, yeah. And she didn't have
Fats
to
are her
eat.
primary source of weight gain now, we would
Mm,
consider. I mean, if it's not butter, heavy whipping cream, I mean, as a weight gain, as a kid who struggles to gain weight, that's our first whole fat cheeses, yogurts. She does not have a food intolerance to dairy. We definitely ruled that out.
yeah.
Thankfully, because honestly, that has helped us get our gal to our the small weight gains that we get.
Yeah, yeah. And I think that's important from like a practicing side because when you're addressing roots of rashes that have fungal beginnings and even bacterial, a lot of times diet changes the big, I don't know, piece, the big lever that we'll pull on. And that really used to be quite a bit of how I practice. But with children, we find that their immune systems are still developing under 7, 8. And when they are greatly dysregulated, those pathogens are allowed to stay and hang out because of the shape the immune system's in, not because of the foods that we're feeding. We can still use those foods as a lever to maybe reduce inflammation like we did at the start, or to calm some GI distress. But really, for Sienna, us addressing her immune system was the key that turned the lock to no more rash stuff, no more issues. So, and she was able to eat like a normal, as much as she is willing to, normal kid for the
Yeah.
most of her immune therapy process. And she still has gotten better. And I think if you've gone through healing for skin stuff and you've already gone the functional route and you've not been successful, um, really restrictive are part of that. And I just want to clearly say that's not the whole thing. If that's not shifting it, there's an immune component, and a lot of times heavier pathogens can be under it. So, last little wrap up question I have for you is, so, Sienna's tiny and you guys dealt with chronic illness in a different way than most people maybe do, or what we think of as chronic illness, but truly she was chronically struggling with her health. Where is one way that you guys felt supported, loved, cared for in your normal realms as you worked through that? What was one place someone really like helped um, encourage or support your family?
Yeah, so we have I have a cousin, her name is Jenny, and she had a son that needed a new liver when he was born.
Mm,
And she had gone through basically from a kid being born with something needing right off the bat out of the womb. And I would say she was just somebody that we could lean on.
mm,
Being seen at a children's hospital, being seen day in, day out by care providers, and being there to say that you need to advocate for your kid.
mm.
And we could lean on her day in and day out.
That's really helpful. I think it's so, especially with children, like a lot of us are familiar with older people who struggle with health issues, but to have a kid who struggles with something and Sienna's issues were super disruptive, but they weren't anything like terminal or like, when somebody has
Right.
cancer, then we kind of tend to know how to deal with or help or support. But knowing that even if you don't understand as like a peer to someone dealing with chronic illness in their child, being a listening ear, being someone who
Being a listening ear
understands.
was
Mm,
exactly what we needed.
yeah,
No one,
yeah.
we have not felt or heard from any parent that there's another Sienna out there that
Mhm,
the care she's needed, or the
mhm.
parent type that you need to make sure that she's getting what she needs.
Yeah, I think that's so big too, because people are quick to offer opinions, right? We're not always quick as parents
Yes.
to offer a listening ear.
Yep.
And I would imagine,
Questioning why she's so small, like just it's it I've grown a lot as a parent just
yeah,
because of it.
yeah,
Yeah.
yeah. I think that part can't be understated either. When it's a first
Mhm.
baby and things are off and you're not sure what's up, definitely following your
Mhm.
intuition and leaning on people who encourage you to do that. And it's okay to lean away from people who want to solve it for you. Because we
Yep.
all want to help, but we don't all necessarily have skills to do that, but we do all have skills to listen. So I love that you shared that. It's very
Yeah.
common with our kid parents. So I guess last question for me, would you do it again?
100%.
Yeah, cool, cool.
Yep.
All right. Well, thanks so much for spending time with me and sharing. Yeah.